Welcome to Perspectives Matter. I'm Amanda Schnetzer. So if we met at a cocktail party and I asked what your brain health index is, would you say, "What's that?" You might know your cholesterol and blood sugar numbers. You might even know your IQ. So imagine a world in which we all have a measure of how healthy our brains are. The World Health Organization estimates that 1 in 3 people will develop a neurological disorder during their lifetime. Yet it's only in recent decades that we've begun to think about our brain health as more than just treating a disease. To help us explore what brain health is, what factors influence it, and what we can do as individuals and communities to foster it, I'm joined today by 2 distinguished experts. Dr. Sandra Bond Chapman is the founder and chief director of Center for Brain Health at the University of Texas at Dallas. She's a cognitive neuroscientist who has helped pioneer the new field of brain health. And Audette Rackley is assistant director of strength-based programs at UTD's Center for Brain Health. Ms. Rackley focuses on innovations that impact the lives of individuals with early Alzheimer's and their caregivers. Welcome, ladies. One simple question: what is brain health?
Well, Amanda, thank you for asking that. Isn't it funny that we don't even know what brain health is? Most people think brain health is absence of disease or injury, and yet nothing could be further from the truth. Mm-hmm. So we define brain health as the continual promotion of optimal development of brain, cognition, well-being, and connectedness. So that's a long definition, but think simply using your brain skills to thrive in your context. That's brain health.
I love that. Using your brain to thrive in your daily context. So I understand we're celebrating a big anniversary in the life of the Center for Brain Health, 25 years of work. Let's talk a little bit about 25 years ago. What did it look like to be in the field of brain health? Was there a field of brain health? And what is different about the approach that you've taken, Sandy, in building the center and fostering this new field of brain health?
Well, and I love that you've asked that, because Audette and I actually started together. So to be here with her 25 years ago, we were in this small 2,000 square foot, just kind of dreaming, imagining, but everyone's like, there's no such thing. You can't do that. And, and I said, I kept thinking, we can, we must. But unless we focused on some type of injury or disease, people are like, you can't get money for that. That doesn't exist. So it really was just the tenacity. So we moved in 1999. We began to start the center, and we grew over these 25 years from a ragtag team. That's what the provost called us, of 25 researchers, research clinicians, to now 150 people that are focused on this new field. And we wanted to do the rigorous science so that it wasn't just kind of, I think it's true. We wanted to show, can we really measure it? Can people really improve your brain health like we know we can heart health? We know we can our teeth health. We know we can our skin. Why not our brain? And in fact, we now know our brain's the most modifiable part of our entire body. It changes moment to moment by everything you do, good ways or bad ways. So we wanted people to know what are the good ways and make it stronger.
I love that. Let's put that in the specific context of your work, Audette. I understand that you have built a thriving strength-based program about dementia and early Alzheimer's. Tell us about that program and what's different about the way you all and we all should and are thinking about brain health and Alzheimer's maybe 25 years ago versus how you think about it and work on it today.
You know, what's really interesting is Sandy was telling us about brain health. And so what we now call brain health, how we referred to it in the early stages or early days of the center were strength-based interventions. And so what we did is when people came in, or we had a research study so that people who had a recent diagnosis of Alzheimer's, rather than focusing on what was impaired, we focused on what was still preserved. So instead of asking detailed questions, we tapped wisdom and opinions, and we helped tap those things where they could feel successful in engagement. And what we found over that time was that there was a benefit in combination with medication. And so now it's like we've just evolved that whole concept of brain health has changed. So that philosophy and how we apply it now is still the same. but the focus is looking kind of holistically, taking a step back and seeing what are the things that we can control, and let's focus on that rather than what we can't control. We just really try to promote that conversation about topics of interest that pertain to where they are with the diagnosis.
And I love that Audette, she had her group early on write a book and tell their stories, because they were studying the greatest generation of stories and, using that as stimulation. And they went, well, our lives were great too. So she worked with them and tell them about the book that they wrote together that was really transformational.
Yes, there was one of our founding we had a young age onset group, and one of the founding members is named Temple Stark, and so the name of the group was Stark Club. And so in that book, we focused on each individual story, because they said we have things that we want to tell. We have things we want to offer to people who are on this journey. And so to give them that sense of purpose, because that's one thing I want families to know, is everyone needs a sense of purpose, even people with a diagnosis of Alzheimer's. So we try to help them realize that. And doing that book was something that we're so proud of. And I will say, fast forward 25 years later, we have done video testimonials. And so once again, just from a book to videos, that has a broader reach. And these families who participated in that, they're very proud of being part of helping other families on the journey. Yeah.
I love that. The care, we sometimes forget, or we just don't remember that when someone has a diagnosis, say, of Alzheimer's, there may be family members and caregivers who also need that support and validation. So I love that you all are thinking about both the patient and the circle of support around them. Sandy, I would love to talk about another of your signature programs called the BrainHealth Project. I alluded in the opening to this idea of a brain health index, and that actually exists. So what is it, and what does it mean to measure our brain health? What does that look like?
Yeah, so the Brain Health Project was a landmark study that we launched to see, could technology, because we didn't want people to have to go to centers of excellence to be able to get a brain health index. They need to have access to it wherever they are. So we wanted to see, can you do an index online? Can we do the strategies to help people use their brain online? And can they get the coaching so that they can continue on? So the project is to test that. We have now tested the index in person with hundreds of people and now thousands of people online, and it works. We had no idea the complexity of the most complex organ in the entity in the known universe is our human brain. Can you measure it? So our index now, and it's not just one or two little things. People say, well, I'll do it in 10 minutes. I'm like, really? The most complex organ in the known universe you want to do in 10 minutes? So the index takes about an hour and 10 minutes. But we found these 22 measures come out with 3 factors. One is clarity. Can you engage in problem solving very quickly, agility of thinking, strategic learning to move the needle forward? The second big area was connectedness to people and to purpose, like Audette talked about. That alone, connectedness, changes your brain health index tremendously. And then the third area was emotional balance or well-being for people, because all of us are dealing with so much stress, anxiety, and depression. But do you know you can find a way through and use your cognitive skills to do that? So the index is actually very different from every other measure that exists for the brain, because they were developed to, guess what? Tell you what's wrong with you. Do you have dementia? What problems do you have? Do you have dyslexia or whatever, what's going on? This is the first time that we can measure, and it took 2.5 decades to fine-tune it, to see wherever you start, are there things you can do to make your brain stronger? And it works. To see if you do the strategies.
Do those measures look different depending on, say, age? A 5-year-old, a 25-year-old, a 50 or 80-year-old. Do we measure our brain healthiness and our brain fitness the same, or does it look different at different ages or stages of life?
So the project we do, because it's online, we start at 18, even though we work with people 10 and older, and so we're meeting them, but this project is 18. So do they look the same? the good thing about the brain is each of us has our own ways of finding our strength that continue to help us thrive in our context. So your brain health index and mine may be equal, but for very different reasons. And so it's just kind of informing you what are the tools you can have to make it stronger. But one of the most shocking findings for me in our study was that we found 20-year-olds improved as much as 40-year-olds, as much as 80-year-olds. We thought that people 80 would maybe improve more because maybe they'd lost more. But there's a lot more ways to help because it's you against you, not you against the rest of the world. And most of our measures are you in the 1 percentile? But are you Amanda against Amanda? So that you compete with yourself, but not everybody else. And that's very different.
Very, very different. I want to get back to something that you mentioned just a moment ago, Sandy, and maybe put it in the context of Audette's work. You mentioned the role of technology. We live in a world of technology. We talk about innovation all of the time in all aspects and walks of our lives. But I'm interested in how technology in the last 25 years has changed how you're able to do your work. And maybe even look into the future a little bit, how it might change the future of how you do your work.
Yeah, well, one thing that's been very dramatic and changing is doing our early Alzheimer's programming online. And we just launched that. It's a nationwide program. Every week I have people from coast to coast in our groups. But part of that was really made possible by COVID because, people became familiar with getting online, and so it's not as intimidating. And kind of what we think is there's so many places that really don't have anything for people with a diagnosis, or they have very few options. And I will say that many people in my groups have not even interacted with someone else with dementia, and that could be very isolating. And so with technology, that really opens up that opportunity to start a conversation where maybe it wouldn't be necessarily had otherwise. And one of the things that we want to do, a big thing that Sandy's a part and the center is a part of, is being an advocate for brain health. So how can we help families not only advocate for themselves, but advocate for others who also have that diagnosis?
That's interesting. And I love what you said about technology. It's both about how do you get access to these resources and tools and even treatments at scale, but it's also about the community of people with shared experience, and that whether it's stigma or other factors, our brains and what could be going wrong with them can be very isolating, and there's still a lot of stigma around it. So I think the role of technology in sort of creating communities for people is really interesting. Well, I want to talk about advocacy a little bit. I understand, Sandy, you are in Washington fairly frequently, and there's a dot to connect between your brain index and how we measure our healthy brain and what do we do about that. And so I'd love to ask you about the policy environment around our brain health. What are the kinds of big topics that you work on when you're talking to members of Congress or heads of government agencies? What are the big topics on your list, and how does the brain index fit in?
Well, I wouldn't say I go there often, but
Okay.
but I do. So I just was invited to speak at the Congressional Neuroscience Caucus on brain health, and their whole goal is to bring kind of the cutting edge science to members of Congress. And what's exciting about brain health is when we spoke, both of the two heads of the caucus said, this is a cause we need to take forward. We think we could get every single member of the House of Representatives to sign off on this because it is bipartisan. It impacts benefits every single one of our constituents. And actually, it would help us to be calmer with each other. So I think that, we rung a bell this time, or struck a chord or something that perhaps we can really get some momentum, and so for us, it's like if we could get someone like the Surgeon General, remember smoking, how the Surgeon General changed it where people knew about it. The aerobics movement back in the 60s was because of a, Surgeon General, and the Surgeon General right now is talking about loneliness. Well, that's one of the factors underneath brain health. But when you approach it from a deficit of lonely, then you just feel, yeah, I'm lonely, I'm in despair. We've got to change the way we talk about things for people to really kind of change the conversation. So Congress could be people say, well, you need to go work with Congress to bring them better brain health.
That's not such an easy task these days.
No, but
you can get bipartisan legislation. More power to you.
Let's try it.
So is changing that conversation and changing that policy conversation, is it about an emphasis on prevention and how that not only improves lives but lowers cost? Or what's the equation at work here? What gets a policymaker's interest
You hit
or
the
attention?
nail on the head. And so we're launching this Brainomics venture to see what would be the cost gain if people's brain health were to stay stronger. If you were to think, if youth graduated from college and had jobs, think about the economic well-being of that. Think about from our military, we've shown, for example, our training helps in 1/3 the time of the typical training get them back into the battlefield. So 60% cost effective, and that doesn't even count getting them back into the work that they need to be done, that they've been trained to do. Workforce, depression, stress is costing employers tremendous amount of money. What if you help people take the strategies to reduce the burnout that's happening, that there wouldn't be so much turnover and changing jobs when people begin the cost growth. I mean, we know the cost burden of dementia and mental health. No one has said, what if we did preventive health promotion for the brain? Just imagine. In fact, they have suggested it is going to be the greatest economic driver of the next century, brain health.
Oh, wow.
Wow.
Audette, tell us, so what does that look like in the context of your work around Alzheimer's and dementia? What does prevention look like? Like, when does that start? And then what are the savings and the benefits that come from shifting the conversation to be more about, not just about treating a disease, but about prevention? What does that look like in your world?
That is a great question. And it's like, if you look 25 years ago, it's like the focus was on really what happens after the diagnosis and how can we intervene then. And really, even if you look at kind of the focus at the center, we've kind of stepped back over the years. If you zoom out, it's like, okay, we can't make a huge impact after the diagnosis. So what about if we intervene in something called mild cognitive impairment, which is kind of a preliminary stage. Many people with MCI go on to get Alzheimer's. But then it's just like step back further to healthy aging. And I know there's a study by Lancet Neurology that a lot of people are talking about that retrospectively looked at risk factors. And so certainly we cannot impact our genetics, but there are many lifestyle risk factors, which, Sandy has been talking about and is part of our Brain Health Project, that if we lowered those, like like depression, physical inactivity, cognitive engagement in terms of years of education, there's a number of risk factors. And if we lower those, could we reduce the incidence, if not even just by postponing, but potentially prevention? That's a question that needs to be answered. But that would be a huge thing. So it's really that focus on starting as early as possible. But I also don't want to forget in taking care of those families who are dealing with it now. Mm-hmm. And really, especially in the early stages, what can we do to help people realize they can continue to engage in life? Because if you think about it, if people get a diagnosis and they just feel overwhelmed and they pull back and they maybe stop engaging in those activities that contribute to brain health, if we're, and even in one of my groups this last week, we were talking about this same concept, and they're like, we quit exercising. There's a lot of those things that we just want to help people prioritize. So even in the midst of a diagnosis, they can still have quality of life. And we think that's really important.
Please go ahead.
Yeah, because the other thing, Audette, and you brought it up before, is the caregivers. So we now know that caregivers are at significant risk for cognitive loss because of the continuous stress of worrying about what happens. So we're very interested in helping them take care of themselves and promote brain health, not just to keep being so worn out and overwhelmed. And so, that cost burden, they're taking care of someone and they're not taking care of themselves. It's a bad equation. So when we make both sides stronger and they start to find joy in that, it changes everything.
certainly does. What I was going to ask a moment ago, Audette, was just if you could give one piece of advice to a family member or a child, a spouse of somebody who you suspect might have a challenge, what's the one piece of advice that you would give them about how to get started? Is there sometimes just being able to broach the conversation with that person in your life can be incredibly hard to just opening the door to supporting them. Is there one piece of advice or two pieces of advice that you would give our viewers about if they're in that situation and struggling with what's the first step to take?
And there's a variety of situations, but one thing that I would say is encouraging people to get a diagnosis is a great first step. And because there are many reasons for changes in memory and thinking, and what if you were dealing with something that you could actually address? And so to be proactive about that is important. But then I also want people to not to rush 20 years down the road and borrow trouble from tomorrow and what they think might happen, because that's where most people go when they think about Alzheimer's. Mm-hmm. And there are so many good days right now, and there's still so much meaning in life that you can have. So don't let go of that just in anticipation of what might happen in the future. Really take it a day at a time and focus on the good that's still.
And what I think I've learned today is in that one day at a time, there are actually things that you can do to maximize your brain's health and fitness today, even with that 20 years down the road. Is that right?
Yeah. And one of the studies we did, mild cognitive impairment, looking at healthy controls, mild cognitive impairment in people with early stage, we did a sleep intervention study and looked at brain energy metabolism. When people in the mild cognitive impairment sleep got better, not only did their memory move into the normal category, but their brain energy metabolism moved into the normal category. So maybe it didn't cure it, but if you can push it out just with sleep, and it's free. So there's easy steps, that can really begin to help people if they knew.
How can we make it even easier for people? We talked about technology, and I think there are lots of technologies out there that help people make this easier to tackle and not have to sort of start from a blank sheet of paper. What are some of the tools that you are working on to help make things easier?
Well, I think the reason it's hard is the stigma. I mean, you said it earlier. The only reason it's hard is because we haven't ever looked at the brain in terms of what its upward potential is. Continual promotion of optimizing brain health. So it's like, I'm not going to get a test. Even when we think about it, even IQ test or school testing, even back to SAT tests.
Oh,
it's
don't
always
remind me.
So removing the stigma. What if you could go in and do it and start annual brain health indexes? So as soon as you do something all along the way to continue this upward trajectory, if things start to slide, you do something then. We need to start in our, as you said, 5-year-old. I mean, we know it through elementary school. And then we kind of, after people graduate from college, we forget. The brain never stops growing, but we go on rote thinking and we lose capacity in our late 20s just because of this. We don't realize there's things we can do. So it's making the index accessible and changing that it's not about the stigma of you're in the 50th percentile or 90th, you're at the low. You're you, against you.
Tell me what that could look like. So I have a 14-year-old son, and during COVID, I think we all learned that we were worried about sense of loneliness, depression, anxiety across all of our populations, and especially focus on youth. When I take him to the pediatrician's office now, it is standard procedure that there's a form to fill out that he's old enough to fill out on his own to assess his sense of mental well-being. Do you imagine that in a not so distant future or tomorrow that I would go into the office or to the doctor's office or you would, and we'd have a standard form to fill out that would assess kind of how our brain is? Or does it look different than that form that my son now fills out? How would that be different? What would that look like?
Well, it looks different because they're still looking at what's wrong. Are we worried about depression? Are we worried about things? So, yes. It wouldn't be a form, but it would be questions that there would be an index. And people always ask, well, do you see it delivered through doctor's offices? For me, it's going to be through schools. It's going to be through workplaces where people are like, we want everyone. The greatest asset that any company has is their brain power. So it's going to be everywhere. The next 25 years, you're going to see people saying, I can hardly wait to see where my brain is and do something about it today and remove the stigma so it's not what's wrong. It will take a whole generation for doctors to be trained in the new brain health. But yes, it's going to be general practitioners, pediatrician, our general, where you can do it to inform. So we need all hands on deck.
I love that. Do you find that there's receptivity for that in the clinicians and practitioners that you interact with? Is there openness to that and willingness to think a little bit differently?
I think the concept of brain health is very engaging for everyone. But as Dr. Chapman mentioned, it takes time from a professional standpoint to change the shift because, most professionals working in, the traditional roles are going to be more focused on kind of treating the issue that brought that person there, which was a challenge point. But I think it's growing, and definitely families are very inspired by that thought, and especially with dementia. It's so often I hear that it's so hard to find a message of hope and potential in what you can do. So our hope would be, in addition to a diagnosis that they would receive and medication, that they would receive encouragement to do these brain healthy practices we've been talking about.
Well, I think that note of hope and optimism is a good place to end, and I see we're out of time anyway. So thank you both so much for your time. This has been very informative, and I know our viewers will take some inspiration about what they can do in their own lives.
Yeah.
Well, we've learned today that brain health is health. Let's wish UT Dallas's Center for Brain Health a happy 25th birthday. And let's also give ourselves the gift of brain fitness by taking simple steps that can reduce stress, boost creativity, and improve our brain's overall functioning. I want to thank you for joining us here at Perspectives Matter as we continue talking about things that matter with people who care.